Autism is a developmental disorder that typically appears during early childhood. On the occasion of World Autism Day that falls in the month of April, MediCircle is conducting an awareness series to help build more understanding towards people suffering from this disorder. Hi, this is Amrita Priya, and you are watching MediCircle. Today, we have Dr. Priyanka Parikh on our show. Dr. Priyanka Parikh is a developmental pediatrician. She had completed her MD, DNB, DCH, and FCPS in pediatrics from Mumbai, securing rank second at MD and a gold medal at FCPS examination. She then completed her MRCPCH from London and got training and experience in developmental pediatrics from both London and Mumbai. She is associated with Bal Asha Child Development Center, SRCC Children's Hospital, Saifi Hospital, Jaslok Hospital, Cloud9 Hospital, and is an honorary at the BJ Wadia Hospital for Children. Her areas of expertise include autism, attention deficit hyperactivity disorder, learning disabilities, slow learners, developmental delay, cerebral palsy, syndromes like Downs, etc. She has many presentations and publications to her credit. Welcome, Dr. Priyanka, to MediCircle.
Thank you, Amrita, for the kind introduction, and I thank MediCircle for inviting me to have this talk during the Autism Awareness Month.
Okay, so Dr. Priyanka, to begin with, what is autism?
So, see, when we talk of autism, it is one word, but it is a big spectrum. So, it is a developmental condition, and children and individuals with this condition have difficulties with social interactions with other people, engaging and communicating with other people. They have limited play skills, and also many of them do have a repetitive pattern in their behavior. So it is when I say developmental, it means that children with autism are born with autism, and it is related to aspects of childhood development. So when we say development, there are so many aspects to development, right? There are the children develop with their physical skills and motor skills. They learn to walk, run, jump. They learn to do a lot of things with their hands. Similarly, they are learning communication skills, language, understanding people, talking to people, interacting with people, learning to play, think, feeling emotions. So autism is that condition which affects mainly the social as well as the communication domains of the development predominantly, along with other patterns of behavior that we see. And also many children do have different ways in which they react to various aspects in their surroundings, what we call as sensory concepts.
Okay. And what about the early signs and symptoms? What are the early signs and symptoms that parents see in their children?
That's a very, very good question, because it is very important to look at and identify those early signs. So when I speak of diagnosing autism, I would diagnose autism maybe at 2 years, or sometimes even younger, at even 18 months, when I'm seeing all the signs. But there are a lot of signs which come even before that. So when I say that, it is a condition which affects more the social as well as the communication domain. So, how does an infant communicate and engage in interactions with parents? We need to think of that. So even as early as 3 months, typically a child will learn to recognize mother, will learn to smile at the mother. By 4, 5, 6 months, there is a lot of to and fro interaction happening between parents and the child, between other caregivers. So they are making a lot of sounds to their parents, to the children. The children are cooing back, gurgling back, laughing. So they are engaging in a lot of what we call as a to and fro interaction. As they start growing older, they start understanding their name. They start responding to their name when they're called by their parents and other members in the family. But what happens in children with autism, that even as early as 3, 6, 9 months, we see that these typical aspects of social communication are missing.
Okay.
Children, may not be really looking at their parents. They may be looking more at objects. They may be, not responding or consistent back when they're called by name. So what we call like inconsistent response. Sometimes they're looking, sometimes they're not looking. And, they may look as if, they're more interested in objects. So if a phone rings, the child may run towards a mobile. But if a parent is calling, the child may look as if the child is ignored. So, not responding to the name, not giving enough eye contact, and also very important aspect of communication, what is called as non-verbal communication. So, see, we do communicate in different ways. It's not just the words that we communicate. We also communicate with actions, gestures. So, very important aspect of communication is what is called as pointing. So, even before a child learns to use the word, say, mama, the child will point at the food or at what the child wants and will communicate to the parent. And there is a lot of this non-verbal communication which starts developing even before the words develop. So the child wants to be picked up, the child will raise hands. So the child is communicating with actions, gestures, facial expressions. But we see that in children with autism, the children are not even able to communicate, they're not pointing or even responding to parents pointing to them. So, showing some things, what is called as joint attention, not just for need, but just to share the happiness, the joy that you get out of watching something. So if you watch the moon in the sky, or you watch some doggy sleeping, you immediately point and show, and look, you also see, or look, you also look at the moon. But a child with autism will not point to even share the joy of watching things, or the excitement of experiencing different things in the surroundings, and will also not adequately respond to others pointing out things to him or her. So this is something which we see is missing, or it's inconsistent, it's not adequately developed. So a lot of these aspects would what we call as show us the red flags. So even if we've not seen a lot of other features which may eventually evolve, but if we start seeing these aspects, when I talk of words, a child would generally babble by 6 months, 9 months. By 1 year, a child is speaking at least one meaningful word. But if we say that the child is not yet speaking, the first words which come by the first year of life, and as a child grows older, by 2 years, the child is joining two words like mama dudu, papa come, papa sit. If we don't see those two-word phrases, even that would be a red flag for us. So we really need to pick up those early signs of autism.
Okay. And what about diagnosis? Like, how is autism diagnosed? Are there specific tests for that?
So, see, when I said that autism is a developmental condition and children are born with it, so it is not a disease, or it is not an infection which you get, typically with germs infecting your body, like how we say typhoid hua, malaria hua. So it is not something which is caused by an external infection, but it is something that the child is born with, and there is a genetic basis to it, and there are a lot of factors, even what we call as genetic as well as environmental factors, and a combination of these factors. And when I say it is not something which the child has got as an acquired infection, there is no medical cure to it. So there are no medicines to cure autism, and again there are no tests to diagnose autism, like how we say you do a blood test and you are you get that malaria report on your blood test report. So there are no tests to diagnose autism like that, like a blood test or a CT scan or an MRI. It is mainly a diagnosis which is based on the behavioral pattern of the child, on the aspects of development that we see as developmental pediatricians. They are based on certain criteria of features that we see, and then there are again certain specific tools which we can use to corroborate all those findings. So it is mainly a behavioral evaluation based on the features.
Okay. So you said that there are no specific medications for cure as such for autism. But what is the best treatment option for children suffering from autism?
So, as we discussed that, it is not that by giving medicines, we can make the child talk, or we can make the child interact or engage with people. There are a lot of other interventions what are required, and it is like a multidisciplinary intervention. So it is multidisciplinary because there are a number of professionals involved, and also there is a role of medications and some select individuals where
Okay.
we decide that this particular child or individual would also need in addition medications to the rest of the interventions we do.
Okay.
So there are a lot of different therapies that are used to help with communication, to help with the child interact, engage with people. There are a lot of different behavioral interventions to help with engagement, with help with the play skills. Especially, an important aspect in autism is what is called as a pretend play skills, where the child learns to do that imaginative pretend play, where pretending to feed a baby, or pretending to give a bath to the some of the animal toys, or pretending to do something with a kitchen set. So there are a lot of interventions to work on a lot of these different skills. So there are different therapies like speech therapy, there is occupational therapy, a lot of different behavioral interventions. And again, there may be some children who may have associated what we call as comorbid conditions. Could be
Okay.
comorbid medical conditions as well as behavioral conditions like extreme hyperactivity or extreme aggression, or extreme self-harming behaviors. So again, when I talk of medical, there might be some children who may have epilepsies or even gut related issues. So we may have to use medications to help and control those comorbid conditions that we see. So
Okay.
it is a combination, and again, it is not something like a one size fits all. So
All right.
it is not something that you just write a prescription and give, but every child is just one word, but every child with autism is different, and we
Okay.
need to tailor the interventions for that particular child.
Okay. So there is individualistic approach towards treating
Absolutely,
children.
absolutely,
Okay.
yes,
All right. So this is how like autism is dealt with by parents as well as caregivers and health professionals, so that children can lead as much as normal life as it is possible in a manageable way.
yes, and it is so important that the interventions, as we discussed earlier, picking up early signs and intervening early. So even if, before I make a diagnosis of autism, but if I'm seeing some signs, I can always intervene. I don't have to wait for a diagnosis or a name to be given to the condition. But if I'm even picking up signs, I can always start, and I should always start intervening. So it is very important for parents to if they are seeing any red flags, or if they are even picking up some concerns, to immediately meet their doctor, meet a developmental pediatrician, to understand the different aspects of development, to also understand whether we should start with interventions or wait. And as I said, it's always important to start with the early intervention rather than waiting, so they understand the importance of early intervention. And then it's
Yeah.
important to even monitor the evolving behaviors. Further going
Okay.
on, what is most important in addition to these interventions is a supportive family, a supportive environment, people to have acceptance and understanding of the condition, as well as with schooling, what we call as inclusive schooling. So it
Yeah.
is not just limited to the child and the therapist and the parents, but it's the broader understanding at the level of the society, because a child needs support throughout. So it is not about just doing a skill in the therapy room, but when the child is out in the world, out in the school, out with other children, out with the teachers, and in different social situations, people also have an understanding of the condition, and also understanding of the skills as well as challenges that the child has. It will really go a long way to help the child.
Yeah.
What we call is inclusive environment,
Yes.
acceptance and
What I gather is that the whole society as a whole should be supportive, because that society for autism children comprises of not only parents and caregivers, but also teachers, friends, uh, parents of friends, and other non teaching staff in school. So everyone should be understanding towards them so that they develop
Yes.
healthy, happy beings.
It's opportunities. It's the opportunities to participate in different activities in the school, whether it is sports or whether it is anything related to drama, and even further going on, training them even from vocational point of view, job opportunities, inclusion in the professional job arena. So it's a long way, and we need the understanding of all people of the society to help these individuals to
Okay.
maximize the ability to their full potential.
Yeah. So thank you, Dr. Parikh, for your insightful views on autism, because programs like this are going to really be very educative for the society, because children with autism are living in the society and everyone should be understanding towards them to really help them grow and bloom. So thank you
Absolutely.
much for your expert opinion.
And thank you, Amrita, for inviting me, and I thank you, MediCircle, for taking these initiatives, to spread the word across, a larger society.
Yes.
Thank you.
Thanks a lot.